Metformin is a guanidine derivative discovered from French lilac. It's a biguanidine compound, meaning that it contains two guanidine molecules. Initially, after it was discovered in the 1920s, there wasn't much interest in it as other guanidine derivatives, such as syntholins, were available, and even these were displaced eventually by insulin. The reason these alternative guanidine derivatives ended up phasing out was that they had these severe side effects of lowering blood pressure and heart rate. This was what led to metformin's comeback in the 50s, with Y. Garcia using them to treat influenza and noting its blood sugar lowering potential. And Jean Stern, a French diabetologist, investigating the effects of metformin in 1957, which he published in the following study. This controlled trial was mainly responsible for the resurgence of metformin as a treatment for type 2 diabetes. Currently, metformin is a frontline treatment for diabetes treatment according to the American Diabetes Association. It has a few different mechanisms of action, which it uses to reduce the amount of serum glucose in the blood, but crucially without increasing insulin secretion. It also reduces endogenous glucose production by the liver, endogenous meaning growing from within your body. The liver can mobilize fat stores and excess energy to produce glucose that it dumps into the bloodstream. It does so by activating AMP kinase, which can inhibit gluconeogenesis. AMP kinase also has the effect of stimulating insulin signaling and glucose transport in muscles. This is an overview of the current mechanism performed for insulin's mode of action. Metformin is not just used for the treatment of diabetes, it's also used off-label for the treatment of prediabetes, gestational diabetes, polycystic ovary syndrome, and to treat weight gain from antipsychotic medications. I won't be going into too much detail about these conditions. Instead, the focus of this video will be on the cutting edge of metformin research, such as its potential as a longevity drug, does it have cognitive benefits, and its potential as a nootropic, and surprisingly for the treatment of cancer. I'll wrap up the video by listing out the pros and cons of hopping on metformin as an early preventative measure. This review of 53 studies by Muhammad and colleagues published in 2021 considered the effects of metformin in terms of its anti-aging effects. These are some of the key points that they were able to glean. Since metformin can act on AMP kinase and inhibit mTOR signaling, that might be the reason behind its anti-aging and cancer protective mechanisms. Faulty or excessive mTOR signaling is linked closely with cancer. This is because of what mTOR does or signals in the body, cell growth and proliferation. That makes it a key target for cancer treatment. Part of the reason that cancer might become more prevalent as people age might be because of a decrease in AMPK sensitivity and an increase in dysregulation of mTOR as people age. You can read more about the actual deviations in this paper. But moving back to excessive mTOR signaling, it is a hallmark of cancer. According to this study posted in 2005, diabetes patients who were being treated with metformin as opposed to other therapies reported a lower incidence of cancer. The question is, are these positive results because of metformin itself or a secondary effect of combating damage that accrues because of diabetes? The second point to make about metformin and its potential anti-aging effects are its cardiovascular effects. According to the CDC, heart disease is the leading cause of death for men, women, and children of most racial and ethnic groups. In 2022, 1 in 5 people died from heart disease. The endothelium is a single layer of cells that lines your blood vessels. Metformin exerts an anti-aging effect on the endothelium, which is downstream of heart disease. Whether this is a direct effect or a secondary effect of lowering blood glucose levels is not exactly clear. I think this randomized placebo-controlled study that followed 390 patients over 52 weeks was very interesting in that it did conclude a reduction in biomarkers associated with endothelial dysfunction. This leads me to talk about indications that it might be beneficial for brain health. Brain health and heart health are crucially linked since the brain is the most energy-intensive organ in the body. If metformin improves cardiovascular health, then it might be that it can also act as a neuroprotective agent. I found this review by Campbell and colleagues published in the Journal of Alzheimer's Disease. When it came to cognitive performance, they said the two RCTs both compared the performance of patients treated with metformin to those who received a placebo. Go et al. Showed that in patients with diabetes who also had depression, who were not receiving insulin or any other anti-hyperglycemic medication, metformin over 24 weeks significantly improved cognitive performance on all items of the Wechsler Memory Scale revised. The question that concerned me after this was, these people already have diabetes. Would this be beneficial to take for someone who doesn't have diabetes? The review also considered a second randomized controlled trial where the effect of 12 months of metformin therapy in patients with amnesiac mild cognitive impairment and body mass index greater than 25 but no diagnosed diabetes. Changes from baseline in selective reminding task significantly favored the metformin treated patients. However, changes in the other primary outcome, Alzheimer's disease assessment scale, were not significant. This was interesting, but I'm not sure if I'm entirely sold on metformin being classified as a nootropic, and that I think of a nootropic as something that enhances thinking, learning, memory, and prevents cognitive decline with aging, or even might recover that cognitive decline in people who are older. Metformin does have some evidence of it being a neuroprotective agent in patients with diabetes, but saying that someone who doesn't have diabetes should take it as a preventative measure, motivated mainly by its cognitive benefits, is not something I would personally recommend. Something I should mention about people considering taking metformin are its side effects. They are twofold. GI effects, as in constipation, bloating, diarrhea. Some people might even be allergic to it, and it can also result in a B12 deficiency. So if you are taking it, you should consider supplementing with B12. It doesn't have a very extensive side effect profile from what I read in the literature. Overall, the two things that came up for me were the GI effects and the B12 deficiency as its side effects. The overarching question that I kept running into as I considered the literature was, would this work for someone who is not diabetic? This is something that needs more research, which is where the TAME trial comes in, targeting aging with metformin. This is a 6-year trial, and the results won't be out for a while, but you can go sign up for updates on their website. Lastly, if you are considering taking metformin as a preventative measure, I would recommend that you check out the current literature and make a personal assessment of whether or not the data is compelling enough for you.